Call to order, pledge allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it
which it stands, one nation, indivisible,
with liberty, justice for all.
Roll call.
Mr. Bornaro?
Here.
Mr. Grady?
Here.
Ms. McNair?
Here.
Mr. Miller?
Here.
Mr. Paradis?
Here.
Mr. Fernandez? You have a quorum?
Okay. I think there's anybody else.
No.
All right, may I have a motion to approve the November 12th, 2024 regular meeting minutes?
Make a motion to approve the minutes of the November 12th, 2024 regular meeting.
Second.
Discussion. Those in favor?
Aye.
Aye.
So moved. Okay, item F1.
So for those of you who don't know, Lee Palmer is online. He's been the interim town manager since Arosh left and through basically New Year's. He will be here. In your packet, you have the fiscal year to date November P&L for the V&A to see both revenue and expenditures. You also have a letter. You probably recall this. I know Arosh had shared it out during the budget season last year. We worked with one of the partners from Shipman Goodwin who has some expertise in the State Department of Public Health, the regulations. And this was the guidance that was used to try to skinny down the V&A to as bare bones as it could be while still complying with all of the regulations. In addition, the director left. Edita Hollis has stepped up. She is the supervising nurse now, and she is going through the training effort to become the supervisor, to become the director. And in the meantime, you approved a transfer last meeting about funding someone with oversight. That's been a requirement of the State Department of Public Health. Last meeting, you asked if the town attorney and the interim town manager could join. The town attorney actually has a conflict, could not join tonight, which is why we're meeting at normal time. But as I said, Lee is on, the interim town manager, and he can share with you and answer any questions you have on efforts that have been undertaken to hire a permanent director, as well as efforts that are underway to develop Edita's credentials so that Edie can be that director.
Yeah, I think just before I begin, last month's discussion was more how do we get into legal guidance depending on what happens, what I mean, because we've gone through this memo before. So what we're looking for, let's assume that person doesn't achieve directorship, okay? What's our legal options for that? Those are the kind of things we were kind of looking for. So that's why we wanted to meet with the town attorney. No offense, Lee. That's the reason why we want to input various different options from the, from a legal standpoint of the town attorney.
I mean, if you go through the charter carefully, word by word, you go through the bylaws of the commission, all it says is provide services. It's ambiguous. And when you look at some of the questions that got asked of the state, whatever they talk about, can V&A's merger together, and they say yes. Can V&A's outsource it? It all depends on your charter, your bylaws. And ours is a little bit ambiguous when it comes to that. Nowhere in it does it state that must be staffed with Berlin town employees. It doesn't say that. So that's the kind of questions. We understand the efforts that are going on, and maybe this will work. But what's this, the fifth director since I've been on the board of finance? So even if we find somebody and go through that effort, we've been here every year since I've been on the board of finance. It's like a hard position. And part of it is probably because in this industry, it's not very lucrative, I wouldn't think, to be a director of a V&A that has 3 employees versus you can go out to Harvard Healthcare or Trinity Health or any of these other and actually have a career where you can progress upward and onward type of deal. So it doesn't seem to be a very appealing position. That's my opinion. So that's why I think we were very interested in, kind of kicking the can around about what are the options. You know, that should explore. I mean, maybe there are options even to merge. There are, you know, there aren't a lot of town VNAs, but there are other VNAs out there that it might be possible to merge or contract with. You know, when we have a singular perfect point here that coordinates with that agency, and you know, we don't have to worry about all the per diem stuff and the billing and all this other stuff that just, why are we in the healthcare business?
I'm not defending.
No, I know, but
VNA. I mean, it's in the
that's what we were
charter.
trying to get at.
I can ask
so-
Jeff if he can attend the next meeting.
because that's what I was looking for.
I'm happy to do that.
I have a question, you know, and I don't know if, Lee, I assume you've seen that staffing, letter that was provided to us. And I, you know, in looking at this, you know, it's clear that the administrator and clinical supervisor and primary care nurse must be an employee and must be full-time.
Correct.
When it gets to the PT supervisor, OT supervisor, ST supervisor, social work supervisor, how are we staffing those now? Is it inside people? Is it part-time people? Is it contract people? And if it's contract, what type of compensation are we paying?
Well, basically, you know, the two employees that we have are Edita and Marlo. And then, you know, the staffing that you see per
Lee,
diem.
I'm sorry, I don't know all the people there, so if you could refer to it maybe by position rather
Sure.
than by.
So you have the acting administrator and then the assistant. And that's it. I mean, the third person that was in there, she saw the handwriting on the wall, she left. And so basically that's it with regard to the town side staffing. And as you can see on the list here that was provided, that there are other per diem employees, but again, in terms of the staff that we have, it would
So
be
a
the administrator.
supervisor, a PT supervisor can be a per diem employee
Yes,
or a per diem contractor?
yeah, I mean, we've had no choice. Again, and I'm not going to revisit, obviously, you've gone over the financials many times. My role really was to try to figure out a way, given the cuts in the program, to work with Kevin to try to make sure that we're staying within the budget that was given and to at the same time meet all of the mandates, which are very clear in my mind with regard to Shipman and Goodwin's letter, with regard to the town charter, which is binding. I mean, the town also has a code of ethics, which basically indicate that we have to follow obviously all of the charter provisions. I've actually called in the Central Connecticut Health District director, and I've asked him to do several things because again, I'm concerned that we're even meeting with given the very, very small staffing that we have, that we're meeting our mandates under state and federal guidelines. And, you know, again, so I've asked the Central Connecticut Health District to come in to meet with us and assess the current operations and identify gaps in services under state mandates and town charter, to look at any opportunities for quality improvement in clinical operations and identify any areas that are exemplary or in need of attention based on our staff clinical experience. And this is from the head of, again, this is from Charles Brown. And also to provide a report to me relative to the findings, because again, I have to say, and Kevin can speak to the financials better than I can, I suppose, but again, I think that the staff there has done an incredible job. Right now, we're at, I think it's 0.53 of expenditures for the entire year, and that's with all of the cuts in their budget. I mean, I think Kevin's kind by saying bare bones budget. But I mean, so we're trying to look at it from that standpoint. Jeff D'Onofrio, obviously, as a town attorney, I've spoken with him. He and I have had the same conversation. It's very clear to me, and again, I'm the newbie here, I'm the newcomer. But there's no question that in Jeff's mind, based on my discussion with him, that, you know, as long as the charter exists as it is, that we have to meet the provisions of that charter. And in addition to that, like I said, any federal or state mandates relative to healthcare and providing the services that the town is mandated to provide. And again, you know, the goal from my standpoint is to try to balance that with the budget that we've been given, that I've inherited as a town manager, and to try to make sure and to work with Kevin's office to get as close to that number with regard to financials as we possibly can. And I think Kevin presented to the board the numbers as of the most recent numbers and where we're at in terms of expenditures and revenues. And again, I think it's quite amazing, quite frankly, given the cuts, that we're as close to the target as we are. And I believe it's, correct me if I'm wrong, Kevin, I think it's 0.53. Is that correct?
I'm not sure what you mean by the 0.53. The loss as of right now.
Yeah, the expenditures, where we are in terms of the budget.
Yeah,
No,
we're
I think there's,
we're at about 47% to budget, loss of about 285,000
Yeah.
through fiscal year to date November, as compared to 396 last.
So,
So
I mean,
So Kevin, we're losing $287,000 at the halfway point.
Correct.
And that's with the reduced staffing.
Tim, I'm sorry. What did you say?
So we're at the halfway point. We're down $287,000. We're losing 287 with the reduced staff.
Yes.
285. Yes, through November.
And how many? What do we actually have on for staffing right now? We have an administrator / clinical supervisor. We have a primary care nurse and a secretary. Is that?
There's actually
no.
the administrators, the acting administrator / supervisor nurse.
it's, yeah, it's, that has a staff.
Yeah, there's a clerical person, and then there are 2 full-time nurses. The balance are all per diem. The home health aide position as a full-time position was eliminated coming into the fiscal year. And then as needed, in order to secure patients, if they need home health aide services, we have to provide it. Anybody does, whether it's Hartford Healthcare or anybody else. If the patient needs it, it must be provided. We're doing that on a per diem basis, being able to leverage, I guess maybe better words, utilize the health aides who were in the VNA, who went over to the Board of Education, and who bumping displaced the existing health aides. So the same health aides who would have been in the VNA have the opportunity to come over.
So we're not actually at minimum right now required by DPH. We're close. Okay, I lost the meeting.
It doesn't sound. I mean, I know you say,
I got you now, Kevin.
I'd really like to see how it's codified in law.
Yeah. Well, I mean, this letter seems to say no, that that's not
No
possible,
anyone.
but
Yeah.
was that
Charging.
question ever really asked?
Well, the
They,
problem is these
again,
guys are not the guys we asked the questions.
As long as we stand. I mean,
I
we
back
remember,
up, but
this went back probably 4 years, 5 years, we've been asking them. The town attorney was here and had the dialogue around how long would it take? You know, what could you do? But I can ask Jeff to rejoin, and if he can't join next month, if he has a conflict, to at least potentially zoom in on a budget meeting and be able to provide that input to see what options you have.
The other thing that's in the charter, whether it could ever change, but they're also guided by the BNA direct board of directors bylaws. They can change their bylaws, so they can make changes to things. As long as they're not breaking any state laws, they can change some of the things that talk about doing. And actually their bylaws don't really talk about, they just
The
talk about,
structure.
we need to provide these services. Doesn't say how, doesn't say in-house employee, doesn't say any of that in their bylaws. I have it.
yeah, but George, the problem is the DPH is telling us what we have to have. They're telling us what our minimum staffing has to be. We can't get around that.
Doesn't mean
I
that.
was going to say, I mean, the charter is clear on that. I don't understand the confusion. I mean, you're looking for ways to work around the charter, and the charter's a charter. You've gotten a legal opinion from Shipman and Goodwin, which is one of the best law firms in the state. You've got an opinion from the town attorney, who's outstanding. And, you know, the bottom line is, when you read the language, and I've heard other people on the board here say, it's clear on its face what you need. And so I'm not sure why. And the other thing is, these are also bargaining unit employees. You know, they're unionized employees, they're town employees. We have a vested interest in them. And we have a person who is willing and able at this point to go through the program to get certified. She's in the process now. The state extended it to December 31st. I've just put in a request to extend it again through June of 25, because it does take time to get her program completed and based on the state requirements. We also have Sarah, who's working with the town as the consultant, the expert, to make sure that we are doing everything we're supposed to do. And again, we're down to literally 2 people in the office. And so, you know, the bottom line is, unless that charter goes away and unless the state and federal requirements go away, then we need to figure out how to fund this in a way which is going to meet those legal requirements. Because like I said, I've already asked the Central Health Connecticut Health District to come in and do a gap analysis, because I have concerns that we may not be meeting our mandates. And if that's the case, then we're looking at additional staffing, whether it's in-house or through contracted services, and we have to find the means to pay for that.
I would challenge you and I would challenge the attorney to show me the specific language in the charter that specifically outlines they need to be town employees versus providing the services to the town. That's what's in the bylaws, that's what's in the charter. We must provide these services, visiting nurses services and so forth and so forth. It does not say that you have to have a town entity that employs their own nurses and whatever. Otherwise, then how did we get to per diem OT people, per diem PT people? How are we?
Because the only ones,
doesn't say in the
the
charter.
only
Can I
ones
finish
under
speaking
the
without
charter that
speaking?
have to be
Let
town
me finish
employees.
speaking, Lee.
Pardon?
It also does.
I don't want to talk.
Say in the
I don't
charter,
want to talk
or it
over it.
does say in the charter that they will provide services to Berlin residents, but yet they've gone beyond that and started providing services to other towns, which is not allowed by the charter either. So there's a lot of things being done that are not specifically codified in the charter.
I
You
will
know,
reach out.
again, I'm not going to debate with you the legalities of it. That's what the town attorney is for. That's what Shipman and Goodwin is for. You've been advised by the former town manager, had Shipman and Goodwin look at this very issue. You know, they've been very specific and definitive in their position paper in explaining that. Jeff D'Onofrio will confirm it. I will certainly confirm it. And if you want to debate that, that's your prerogative.
I'm not
But-
asking you to debate it, but we've never had the conversation where we have talked about options and the fact that this is not working and we cannot keep a director.
Who
on
says
staff.
it's not working?
You have not been here for the 5 years where we lost a director every single year. We cannot keep continuity. What says
Well,
it's not
because you
working?
keep cutting
Number two,
position, who would stay in that environment?
Well, I
You
will
keep
reach out. I will reach out to Jeff and see if he can join in the January meeting. If he's not able to join, I will ask him specifically if there is anything within the charter and or bylaws of the VNA that specifically indicates an employee must provide
And it can't
all
be
of these
contracted out.
services. Sounded like, correct me if I'm wrong, that the potential scenario you might consider would be an administrator who would then be able to oversee the outsourcing of that function.
or a merger.
Yeah, if
You
that
know?
will
Okay.
satisfy
No,
DPH.
We're just trying to brainstorm if there are other options. Not saying we don't want to provide DNA services.
Lee, I'd like to ask you a question in terms of, we're trying to look for some kind of budgetary limits or budgetary restraint. And, we're looking at this department and it almost seems like, on one hand, you might want to say, okay, well, we'll do all of these things that are minimally required and do one nurse. And at that point, I've heard some things being said about, this need to provide certain services and whatever. But isn't there some responsibility down at the agency level then to say, okay, we've given them the money for one nurse, therefore they're going to be limited in the number of people that they can take in, or they can't take in new people because one nurse can't service those people. We don't just give carte blanche to Park and Rec when they come and say, oh, well, we want to run a program that's twice as big and we've got people lined up and we say, well, you got to live within your budget. How does this fit within the structure of what we're dealing with?
All right, so if you look at the response number 3 in Shipman and Goodwin's letter, they speak to the fact that the administrator must be an employee, must be full-time. the clinical supervisor must be an employee, must be full-time. The primary care nurse must be an employee, must be full-time. And then there's an asterisk under the administrator that says, as you know, the supervisor in clinical services can also serve as the administrator. That should be. So to me, it's pretty clear from that, and we can debate all day long, but that's pretty specific language that says they have to be an employee, which means an employee of the town of Berlin,
But
right?
that wasn't my question. My question is, if we give them one nurse, okay, and that satisfies DPH, right? Because it says here, there has to be, well, there's one primary care nurse.
Yep.
We give them that, okay?
Yeah,
And they come around and say, well,
We want
you
to
know,
100 people.
we want to bring in 100 people into the program, all right? My feeling on it is you can only take in as many people as that one nurse can handle. Is that a fair statement?
to a
No.
point. To a point, yes. But I also think that that's why from time to time you use per diem, because if, let's say, mandated services are required, right? And the primary care nurse is, I don't know, meeting with 6 patients at the same time or whatever realistically can be handled, then I could envision a scenario whereby you would utilize a per diem, where the administrator would get a per diem to supplement those services to provide mandated services. You know, I mean, I would defer to
When
the
you say mandated,
healthcare.
when you say mandated services, that's
Right.
services to a patient you've already accepted. Right? What I'm saying is they should, if that one nurse on staff is full to capacity, they have the responsibility to say, we can't take on new patients.
We landed on the clinical nurse / administrator position and 2 nurses. Because you have a couple of circumstances that are absolutely required. Number one, we have on-call nurses every day and every weekend. So if we had only one nurse, you would be essentially asking that one person to work 7 days a week, 52 weeks out of the year. You're never certain when someone will have a need. So you always have to have someone else there.
Let me ask you a question. Okay, I understand that if you're talking about people that are already in our system, already enrolled as patients. But if someone new calls and says, I need a service, can't we at some point say we don't have the people to provide to you, call Hartford Healthcare?
Problem is, even if you have one patient, you have to have on call.
If we have one patient, we have a nurse that we're required to have. So
But your nurse is
About
also,
7 days a week.
but your nurse is going to take vacation. Your nurse could get sick. Your nurse might get injured.
It's still not his question. You just say, you know, we have a capacity. If we go capacity +1, can you tell?
Right, but I'm
Even
saying,
if you had only
Depends-
one
We're
patient,
not talking about whether you need 2 nurses or not.
yeah, but if you only had one patient, that patient needs 7 days a week.
I think we all
52.
understand.
so the
So
capacity
that
is
one
at minimum of
person
2.
can't
What
do
he's
that.
asking.
Well,
That is,
it's
you
a
need
full-time
2.
and a per diem.
Well, you wouldn't have necessarily just one per diem, because remember, a per diem can decline coming, so you
We
need
have
multiple.
20 per diems as long as we're not using them all.
I mean, I guess theoretically you could
What
have
I'm
one
saying-
patient, but then you're guaranteed to lose whatever, essentially whatever wages you pay would be a loss, because you're not gonna generate very much revenue with one patient.
We're not generating much revenue now.
I mean, you're not going to have much of a difference doing that. You would be locking in a guaranteed loss.
But you're saying the reason you
We
kept
already did.
the reason 2 people were kept was to avoid having one person have to work 7 days a week, 52 weeks a year.
Right now, they alternate so that if you were to look at the on-call sheet that we go through with payroll in a 2-week period, they alternate who's going to have sort of the main on-call versus the backup from weekend to weekend. And then you always have the clinical nurse in the event that somebody's on vacation, somebody is injured or whatever. This truly was sitting down and, to Jerry's question, to mathematically look and say, how can we realistically support patients 7 days a week? It was designed to say
very
you need
least
the two
number.
nurses plus the clinical as a backup with the per diems. I mean, like I said, the health aides literally ran to, okay, we're not gonna have any on staff. We're going to go just per diem, only for patients who need health aid services. So this was an attempt, and I think a pretty good attempt to say, what is the absolute minimum we need? Because unlike Parks and Rec, you know, you can say, I'm not going to run basketball this Saturday, or I'm not going to open the pool today. If we choose to take a patient, we have obligations. If we
I'm
choose
just
not to
saying,
take,
is there a point where we should be saying, we're not taking any new patients?
But he's saying the same thing happens even if you have no new patients.
Well, you've right-sized it, or you've gone to the minimum that you need to
Yeah.
make this function. Now that you have that structure, what's the maximum number of patient types, mixes that you can handle?
Right.
And if you're at that and somebody else comes along,
absolutely.
You do
can
say
you
no.
Say no.
I'm sorry, we cannot.
Would they ever do that? Do they ever do that?
Do they ever say no?
Yeah.
Sure.
They do.
If you look at this chart and you compared it to the ones you received previously, there is no CCCI on here. They've made the conscious decision that the reimbursement rate is just
Too low.
It's too low. Medicaid, we are not getting Medicaid reimbursement. They always have to be careful because you can't just blanket not take something, but you will see that they've made a concerted effort to focus in the areas where they have an opportunity to generate variable margin off of it. Now, the volume may not be adequate, but all of those things have happened, ratcheting down the full-time staff and moving to variable staff, really evaluating what is the payment that this patient would bring, the payment type, and eliminating those that are not effective. And also looking at, you see New Britain General, there's physician's offices, kind of a general one, and then Hartford Hospital, really trying to focus on referrals from those who are in this area to significantly increase the likelihood you're getting Berlin patients, or there are some out of town, but when you look at that balance, if you have 63 patients, 10 is a much lower number than existed even last year at this time. So Edie has done what's it?
It was a lot higher.
It was. Edie has done a really good job of trying to rebalance that. Some of it takes time. You have patients. Some of it is also those trade-offs, because if you have that fixed cost, there is an element of taking some patients, but she has been very disciplined in her approach. She's done a really good job of trying to balance that. And while the revenue is down, it's actually largely in line with the budget that was substantially lowered this year, no doubt with the revenue. But the net loss is $110,000 better than it was this time last fiscal year. It's not zero, it's not positive, it's still a loss. But I think she's doing a very good job of trying to balance all of those factors, while also training to get the credentials to become the administrator.
Well, and we'll continue to do so through the end of the fiscal year.
Lee, I have a question for you. You've been in the business of being town managers at different places, right, over the
Yes.
years?
Yep.
So in Connecticut, is most of your experience in Connecticut or elsewhere?
Minnesota and Illinois as well.
Okay, all right, so I was gonna ask if you had any exposure, because if you went back, 20 years in Connecticut, there were a lot of VNAs run by municipalities.
Yeah.
And now there are not, and, I think ours unfortunately got stuck because it was in the charter rather than just as a department.
Right.
And in what you've seen of departments, is it possible to run these things efficiently and come close to a business model in a municipal setting?
Well, I believe so. And I think, we're trying to move toward that, quite honestly. And Kevin and I have had many discussions about this to try to obviously narrow that gap and see what we can do to get to a point where we are literally balancing the budget. The problem is, as you know, you know, it's like anything else. If you cut a program, you know, to the point where you can't staff it appropriately, then you may reach one goal and then, you know, end up not hitting other goals, which may be mandated. And so it is a balancing act. And, you know, I think by the time I got here, as you know, the staffing essentially was the staffing with the exception of one additional full-time person who left to take another position because her position, I believe, was being eliminated at the end of the fiscal year anyway. And so, you know, we're trying to work with what we have to achieve, again, you know, both the charter and the legal mandates. And I think we're closing the gap. And to your point, I mean, a lot of towns don't have a VNA anymore. I actually think it's lower than 9, but I could be wrong. But
Great.
I think it's down to 3. And the reality, though, is that, you know, our charter is our charter. And so until that changes, you know, I think, at least from my perspective as the town manager and my successor, has to look at it from the standpoint of, well, how do we do that balancing act given the language and the advice that we're getting, obviously from a legal perspective, but also from you and the council as the fiscal authority for the town? And how do we do it in a way where we're being collaborative and meeting those mandates so nobody gets in trouble? You know, I mean, that is the balancing act. And as long as, again, the way I read the charter, and I think the attorneys involved, our town attorney, read it, I think right now, you know, that's the reality. And so how do we do the best we can, given that language, given the mandates, and at the same time, providing the best care that we can, given the resources that have been allocated. And that's something that, as you, I mean, just based on our discussion, is a challenge, right? And I think we all recognize that.
You wanna go through anything with it, or we pretty much?
I will follow up
Yeah.
with the town attorney, try to see if he can join the next meeting. If he can't, try to
I
get.
think that's important.
Okay. Lee, thank you.
So-
Thank
So-
you, everybody. I appreciate it. Have a good
Okay.
evening and happy holidays if I don't talk to you before then.
Thank you, thank you.
Thank you.
So Kevin, this, I know the VNA budget is kind of offset with the town budget. Are the numbers getting better as we're getting into this now, into this year? Is it looking like maybe we can at least mitigate the losses to where they're at now?
For the VNA or? for-
Yeah.
I think your revenue is probably gonna come in on budget. You're probably gonna see a loss.
We only.
Better than-
we only budgeted
less than last year. But I don't know that it will get substantially better relative to the budget. I mean, you probably will see $500,000 to $600,000 loss.
I mean, right now, based on the year-to-date actuals, Kevin, it's closer to $700,000. And just projecting the average for the first 5 months of cost at 97.7 per month, almost 100,000. Projected for the whole year is almost 700,000 loss, 683%. I just did the mathematical calculation.
Yeah, I mean, one of the things that's embedded in the loss that we had projected to improve was the elimination of that other clerical position, and that actually happened earlier, a little bit, about 6 weeks earlier than budgeted. So it will improve a little bit that way, salary and benefits. I mean, they're continuing to work, they're continuing to try to maximize the 2 nurses who are out there.
So this person that's still trying to be a director, is she progressing from last month, or, because now you extended it for June of next year, right?
Well, he's requested, the state hasn't approved it,
So
but
is that plan that's just probably gonna take till June of next year to get to that level, or is we? just giving you some cushion there.
It's gonna go beyond June, which I believe she has, I wanna say she has 8 classes to
Oh,
take.
wow, she still have what to do.
Yeah.
Okay.
I mean, this has been a chronic problem all along, is we just have people in there with no experience on how to run anything. They can't even give you a basic answers on some of these budgetary things. How much does it cost to earn $1? Is probably the most basic question you could ask, and I haven't heard an answer in 5 years.
When I was looking at their budget, the budget to date stuff, it looked like that, you know, when I look at what was budgeted for per diem labor versus there was a $70,000 budget for per diem labor. Year-to-date expense is $12,000. And encumbered is another 23. I thought we were encouraging them to go more towards per diem labor. I can't imagine how we could have only spent 12,000 out of a $70,000 budget so far this year. I mean, are they?
Yeah. The management decision was made to leverage the current nurses we have with capacity as well as with overtime. And the cost difference is negligible between a per diem cost and an overtime rate. Because remember, at overtime, you're no longer considering all the benefits because those are embedded in the base rate. So the cost is essentially the same as what we would pay for per diem, but you have continuity of care with the nurse. So next month, assuming the council approves it next week, you're going to see a transfer of, I'll tell you the exact amount. So I wrote the agenda item. You're going to see a transfer of $45,000 from per diem labor to nurses as a projection. I could be off on that, but I'm kind of looking at where it is through the first 11 months and projecting. So in other words, the previous director had expected to hire and use a lot more per diems. The current director is finding that it is better for the patients and essentially the same from a cost standpoint to use the nurses. So if you look at that one budget line, you're going to see a lot of favorability, but that's going to move up because if you were to go and look at the nurses line right above it, it's unfavorable right now and getting worse because that's just a staffing decision. The cost differential is negligible. So you'll see the transfer.
So overtime shows separate in your, as a separate line?
Mhm. In the budget to actual for expenditures, there's a line for nurses and there's a line for per diem labor.
No, the overtime. That's separate.
No, that would be within the nurses line itself.
Okay, because I know some other departments have their own overtime line.
Some do. For this year's budget coming up, we're going to be changing that. It will benefit us using the automated time and attendance system to be able to put it through the one line, like for blue collar workers. That's the biggest area where we have overtime is our blue collar workers.
So you're saying you're going away from security?
With the exception of storm overtime and police. The police overtime is material. And we want to keep that separate because that's a substantial six-figure number.
Does that have any detrimental impact to the availability of per diem people if we're never hiring any of them? It's gonna take a job. So it kind of dilutes our bench strength, you know, because if we're using some periodically or occasionally or frequently or whatever, they're part of the team, but that we're not giving them any work.
But I
They're
think
not
those
gonna
per
be
diem
there.
work for like Hartford Health as well. They're per diem for anybody
Some of
who
them are just
hires,
hourly. I know, I understand that, but
so they may not
it's just
realize.
availability.
Yeah.
Just wondering.
We can't even get a number as to whether or not the nurses we have are working up to industry standards as far as their capacity. And the one time we did get some numbers, it was horrible. And here we are, the answer was to go to per diem, where we have a fixed cost and we know what it's going to cost to hire each person to go out to each, whatever that job is, and we're not utilizing it. We're just spinning our wheels. How can we keep cutting something and still lose more money? At this point, I think if we told everybody to go home, we'd still lose $700,000.
Well, Kevin, how do you, if I'm a supervisor, how do I manage overtime? And put it all on one line item?
How do you manage overtime?
Yeah, I mean, I wanna know how much overtime my people is regular time. Now you're gonna consolidate that?
Well, we still have the ability to separate it. So within time and attendance, you're going to see the overtime, whether it exceeded 40 hours in the week or whether it was explicit called in overtime. And those are two different things. managing the call-in absolutely is necessary. But then there are times when they just simply have to work overtime. I mean, the police, the most pronounced example is if somebody calls out sick on a shift, you got to carry over. I mean, they're 24/7. They need the staffing levels. And so people, they have a lot of overtime for that reason. We do have instances where that occurs. Facilities, for example, if we're in August and the HVAC breaks, you know, at 3 a.m. coming in on a hot day, they're gonna call somebody in and try to get it fixed. If the boiler goes at a school in, you know, December or January or February, we need to get that fixed, and they're gonna incur overtime. There's an effort to manage it and not have it go up, but then there's much of it.
I'm just thinking from our perspective, it makes it harder to, you know. It's not just, you know, you can take the budget now and say, okay, there's 4 blue collar, you know, workers at X dollars. Multiply it out, that's the budget. You know, now if we're gonna be throwing overtime in there, it's like, okay, how much overtime is in there this year? I mean, I'm thinking from our perspective on the budgetary side, that's an important piece of data. You know, if we're losing that, you're gonna get a lot more questions as to every department, how much of that is overtime.
And we could include that in the narrative and say this much is budgeted as overtime.
It'll still be information that we'll have, it just won't be separated out as a budget
A
item.
separate GL line. And for most departments, it is not a substantial dollar amount.
No.
Obviously, the police, it's substantial, and we will leave that one spiked out. You know, but some department, the biggest one that I can think of, it could be off, but I think the biggest one is highway. When they're doing the roads, if weather goes against us and they're trying to get the road work done, I mean, you hit this time of the year, they're not out doing roads. So if they're in September and October and we've had a rainy summer, they're gonna call people in and they're gonna try to push for the overtime because they wanna get those road jobs done before the freeze hits. And we bumped theirs up. I believe theirs is $30,000 for the entire year, and that's the very high end. Most of them are much less than that. We try really hard to manage away from the overtime. Obviously, storm overtime is storm overtime. We have a storm, we deal with it. And the police, like I said, they're 24/7. So if they need to call somebody in, they call somebody in. Or if we have the pickle fest or something else that happens, they call somebody in.
I don't know, yeah, I didn't ask the question right before what, but maybe you, in your conversations with the DNA people can sort of zero in on this. It went back to that staffing table where it says we're required to have a PT supervisor, O2, ST, social worker. And it can either be an employee or a contractor, doesn't have to be full-time. Well, must be full-time, question mark, NA. So I'm wondering, okay, we provided 12 speech therapy visits in the month that we're looking, or July to September, okay, I'm looking now.
Yep.
So obviously, we're required to have a ST supervisor. This ST supervisor is contractual, I'm assuming.
Per diem, they've agreed to accept the rate,
Okay,
yeah.
so how does that work when we've done 12 speech therapy visits? And we have a supervisor for these people, and that person is per diem. How many per diems are we wasting on 12 ST visits? Maybe we shouldn't be providing the service if that, you know, if we're required to have a supervisor.
I'm not sure
you know.
why they inserted the word supervisor in
either.
here. There's not a supervisor over these folks. These are experts in their field. So, for example, a physical therapist who may work for Select, I don't know,
Yeah.
I'm picking one. I don't know if any of their therapists do, so I don't want their owners to think I'm telling them they're working on the side, but they work at Select.
Okay,
And let's just say they work 4 10-hour shifts.
Yeah.
And they're off on Fridays. I don't know. But maybe on Friday, they make themselves available to the Berlin VNA.
But they're not a supervisor. They're-
No,
they're
no, I don't
more-
know.
Yeah,
I don't know where the supervisor,
Me
these,
neither.
these are therapists who would work at a Select or,
Well, but if
or
we're
Focus. I
providing
don't
the
want to pick
service,
one or the other.
if we're providing the service, we probably have to have a supervisor.
No, that's,
No?
that's kind of that's where the clinical
The
supervisor comes in.
administrator, yeah.
She's overseeing the patient care. And the patient needed PT services and, or OT or speech therapy or social worker. If you look, for example, that they had, we had 63 patients during this period of time, but only 12 speech therapy visits. Very few patients actually needed that service.
but that clinical supervisor is the one who determines the care that, and she coordinates whether it's a speech therapist, an OT, or
In
whatever.
conjunction with the
So-
doctor,
With the
they're
doctor.
talking to the doctor.
Footnote 2 that says the supervisor of clinical services may also serve as the administrator
Yeah.
in agencies with 6 or less full-time
Mhm.
equivalent professional direct service staff, which I believe we are.
Yeah.
Yep.
So that two employees is one
Yeah.
in our
And that's what we
situation.
have, yep.
The administrator.
Yep. So I don't know
But
why
you're-
the
but you're-
attorney put
But you're saying
supervisor in.
then the clinical supervisor also could be supervisor of all these other.
Well, the clinical
PT.
supervisor oversees the needs of the,
Patient.
yeah, the patients. Like if there's 30 patients, this person needs PT, this person needs this person only needs a nurse. And she coordinates the care.
Keep-
That used to be Cindy.
Yeah, keep in mind, this is not like a traditional staffing model where you would, like, I have people on my team and I manage them day to day. And I
Yeah.
sit over them, but I
There's
oversee
change.
them, I clock in out their time, their days off, all of that. This is clinical supervisor who in conjunction with the doctor is evaluating, what does this person need?
At that time.
Yes.
It could change.
Right, and then, brings in whatever is needed at that point. I mean, you're gonna see, for example, 63 patients, 352 PT visits. PT is a common discharge function, like a patient, we're now taking a patient on, and a PT assessment is a common thing for, I'm not a nurse or a doctor, so I can't say all, but I would say, if not all, an extremely high percentage, if nothing
Right, you
else,
need
for
a
an
visiting nurse.
evaluation. And that's why those numbers are so much higher than, say, OT or certainly speech therapy or social work, because those are very limited. They're not supervisors. It's the clinical nurse who's supervising the care of the patient, and these are kind of inputs.
Well, I'm a little confused then, because all of this table says these positions are required. And the footnotes
Mhm.
go further to say an agency supervisor of physical therapy services shall. Okay, so if we have 12 per diem PT people out there, and I think most of our PT is per diem.
All of it is per diem,
Okay,
and we
so-
don't have 12.
So who is supervising those people?
They're not,
Who is the agency supervisor of physical
Well, you're-
therapy services?
your clinical nurse would do it, but they're not supervising so much the people as the service the people are
But it says
providing.
here, it shall be a registered physical therapist licensed to
Yeah,
practice
could we
physical
be out of,
in the state.
could we be out of compliance because these people, these PT people are not or there is no supervisor?
I don't, I'm not looking to hire another one, but I'm
No, I know,
I'm trying
but
to understand what this is.
see where on the bottom of the page, I agree with Terry. Because it does say PT supervisor, so we may not have a PT supervisor.
I don't know that we've ever, in the 8 years I've been here, we've never had one, and I know Roche went through this thing in
Right.
detail, 3 or 4 meetings with this attorney, so I would be,
Maybe I won't
it's-
ask that.
Yeah,
Possible.
no, we'll be adding staff.
we have never, there was a discussion, I'm gonna say probably 3 years ago. Would the town benefit by reducing one of the nursing positions? At that time, I think we had 5 nursing positions. Eliminate one of those positions. There was a nurse actually leaving. And should we replace it with a full-time PT instead of per diem PT? And the decision was made not to do that. That's the only time in the over 8 years I've been here that I've heard any discussion. It has always been per diem, including OT, social work, speech therapy. They've never been staff. Health aides were, nurses were, clinical
And
supervisor.
there's never been a
admin.
supervisor as far as I know
No,
of any of those.
Do they get audited by DPH?
I don't think it audited by DPH, but they definitely get audited by the Center of Medicare and
Yeah.
Medicaid. They're spot checks. They're not, they will basically let them know, hey, we're coming in.
Is
And
that
we're gonna
more
look.
for billing and stuff, or?
No, it's
Oh,
care,
care.
it's everything. They will evaluate it, and the Berlin VNA has always done exceptionally well.
They got plenty of money.
All right.
First thing is with the nurses and health aides were very good, but
Let's move on to item 2.
Please.
good thing it's a short agenda.
Please, I know.
This is the proposed calendar. I shared it out last month. And every year in December, we vote and then we publish it with the town clerk, and reserve the room, et cetera. So
Now, a motion to approve the 2025 Board of Finance meeting calendar.
So moved.
Second,
Second.
discussion? Those in favor?
Aye.
What I'm doing next week.
Good round.
yeah, right.
Same thing with the
The
other.
next thing is the budget calendar. It's very similar to last year. One change will be holding it, ideally, I'm gonna check, assuming you approve it. For these dates, try to reserve town council chambers where possible. It's just it's an easier venue all the way around to hold it for the audience and for you guys. So I'm hoping it's available and we'll be able to do that. As I mentioned, budget meeting 2 is actually a Thursday, typically meet on a Wednesday, but I have a conflict that night.
Motion?
So moved.
Second.
Those in favor?
Aye.
Moved.
I will keep my update brief. First, as I mentioned earlier, for anybody who happened to be here, the audit report has been completed and published. It is on the website. It has been, the single audits have been filed with both the state and the federal government. So we've complied with the charter and with the statutes, which is a good thing. Dovetailing into that, this is the last year of the 3-year contract with PKF O'Connor Davies, our auditors. They've done a great job. They've been our auditors. Actually, they started their first year was my first year here. So they've done, I think, a really good job. They've really been helpful for us. There are a number of towns that have struggled for a number of reasons to complete their audit on time. In fact, last year, OPM noted that 29% of municipalities completed their audit and submitted it by December 31st as required by statute. There's methods to be able to get an extension. It wasn't like people broke the law, but only 29% of municipalities, and we were one, we've always done that. So as I did the last time we came here, I don't know if you want me to go out to bid and put it out to bid or negotiate separately with them if they come in at a reasonable increase given inflation and all of that, sign and continue with them on another 3-year deal.
Did we ever compete before?
We did. Last time we went out to bid, we had 2 bids. They were noticeably lower than the second bidder. So, and again, we have never had an issue. They have worked diligently with us. We've never had an issue. We did, my first year here, their first year, we did have an extension. But then again, we didn't start the audit until I started October 16th, and we started it basically the second night I was here was the kickoff night. So if you're gonna.
What's the dollar amount on the
Cost.
cost?
Is it's about $48,000 this year all up.
I mean, I'm okay for using an organization, I've been satisfied.
I'd say that, you know, the firm that we have now was one of my competitors when I used to be in the business. There were only a handful of firms that I would say you would want to have your audit done by, and they are one of them. I think their prices are okay. I think they're in line with, I still stay in touch with all my former compatriots. And fees are very competitive. And I think what we're doing, as long as we are, we don't have something that's an outrageous, we should still approve.
You will have to approve it. In the
Yeah.
charter,
Yeah.
you're required to approve
And
it.
I would say that knowing the quality of their work, I wouldn't be looking to change myself.
I will reach out to the partner and see if we can't get something to put on the agenda for the next meeting. It might be hard with the holidays, but I'm hoping we can figure something out and have it settled. Thank you. As far as the financials, we're trending well. Revenue is essentially in line with the same time last year. Tax revenue is up a little bit. We did Friday, for anybody who purchased a car after October 1st, motor vehicle supplement bills will be going out on Friday. Expenditures are up a little bit relative to the same period last year.
Kevin, can I just stop you there? Was the decision made to do them all at once, or is it gonna be done on a monthly basis, or?
We are planning to continue doing them as we have been, so all at once.
Okay.
What we saw within the legislation is it would be the purview of the council,
Yeah,
the legislative body. Because we're not proposing a change, the intent was not to go forward. What QDS, which is the software provider for the vast majority of communities, has suggested is the towns are going to receive monthly files instead of an annual file for supplemental. Their suggestion was hold those and just keep appending each month and then be able to upload and do it annually. There's a couple reasons for it. Number one, we would be required to have a legal notice in the paper. Not the end of the world, but it's several $1,000s that we would have to spend.
you'd have to do it every month.
We'd have to do it every month. Second, you would be basically running a new billing every single month. We could educate the public. I think it would take a little bit of time. We really run the risk of people simply throwing the bill away and say, I already had it, I already paid my bill. Why are you sending me another one? They do that. Some people do that today with the reminder card, which is fine. It's a reminder card. Throw it away. That's great. But if they did it with the bill, now you start to build up interest and other things. So I think people are kind of conditioned. If you bought a car in January, you're going to get the supplemental bill. I think we started doing it monthly. People are going to say, what is going on here? So to avoid confusion, to avoid the cost issues, I feel like.
Plus, for this year, the budget has the
Yes.
supplemental
All
amount.
in.
Yeah, so it would be difficult to change that.
The other part is having a mill rate available. So we have a mill rate now. If we were to do it monthly, you get to a period, you're not setting the mill rate. At the earliest, you're going to set the mill rate is May, because you're going to take a vote the last Tuesday in April by charter. If it passes, if not, you could be waiting. Last year, you set the mill rate at June 10th.
I can't imagine towns going to a monthly,
Yeah.
but maybe there are some.
So that's our intent.
Okay.
The funds, the health insurance, general insurance funds continue to be solid. The pension continues to be solid. I will tell you the $1,331,320 is a very precise number because it is the number that I'll be going to council to next Tuesday to ask for a transfer. The surplus for this year was $614,000, so that will eat into some of the existing fund balance in order to get that. But it would still leave about 15% of the current year operating budget in fund balance, which is solid. GFOA guidance would suggest about 17%. The floor for the town is 11%, so you're sitting right in the middle of those two. The 1.3 million will finish off all of the tier ones that were deferred in the budget. We'll also address a couple of other items